Assalamualaikum. My name is Dr. Talha and I'll be your doctor for today. So let me just wash my hands before we begin our examination. I've made sure that the room that has been provided is private and adequate lighting is provided. Do I have the permission to examine you? For this particular procedure, what we're going to have to keep in mind is that the exposure needs to be of the full abdomen, since that's the part that we'll be examining. I'll be standing on the right side of the patient, and before the patient starts to begin, we'll make sure we do a general examination. For the purpose of the general examination, we'll make sure that we measure the patient's height and weight for the BMI. In addition to the BMI, we'll also be measuring the patient's blood pressure, which will be at a sitting position, and the rest of the examination will be at a semi-recumbent position. In addition to that, what we have to keep in mind is that since pregnancy is a change where there's a lot of physiological changes happening, we have to make sure that we examine the person's pallor, we make sure that we check the patient's anemia, and in addition to that, we also look for any signs of facial edema or limb edema. For the limbs, we have to make sure that there's no abnormal reflexes, so we'll be checking for clonus and edema at the same time. Apart from that, we also have to do, on the first visit, we have to do a thyroid examination and a breast examination. After we are done with our general examination, we'll be proceeding with our specific obstetric examination. For the purpose of this exam, we have to keep in mind that we'll be going through the symphysiofundal height, which is usually measured after 20 weeks. This is extremely important because this signifies the growth of the fetus. And another point to be noted is that after 20 weeks, each centimeter corresponds to the growth or the week of gestation. So that's something that we need to keep in mind. So to begin for the symphysiofundal height, firstly, we'll start by using the ulnar border of our hand to localize the first point of resistance. And the first point of resistance is here, so our hand is at the fundus. Our second hand will be placed at the symphysis pubis, which will be a prominent bony prominence over here. And then we'll use our measuring tape, right? We'll be using our measuring tape to localize the symphysis pubis, which is right here. And we'll keep our 0 at the symphysis pubis. And we'll keep our other hand at the fundal part, and then we will try to flip the tape and then measure the weeks of gestation. Now, why are we flipping this? We're flipping this to avoid any bias, because if it's in inches or if it's already in centimeters, that can lead you to a pre-existing decision, which we don't want. For sakes of accuracy, we'll have to keep it at the inches part and then flip. Now we're done with the symphysiofundal height. Next, our job is to locate the positioning and the positioning of the fetus. For that, we have 4 maneuvers, which are called the 4 Leopold maneuvers. For the first maneuver, now we have to keep in mind that our position will be facing the face of the mother. So we're going to start off by using our 2 hands to try and palpate the part at the fundus, right? Now, when we use our hands and we're trying to feel for what's the part over here. Now, if you feel a part which is large, which is soft, and which is non-ballotable, that would be the buttock of the baby. If you feel something which is hard and regular and ballotable, in that particular case, it would be the head of the baby. After that, in case if the lie of the fetus is transverse, you will not be feeling anything in the fundus. After we've confirmed the part of the fundus, our second Leopold maneuver will be to locate the back of the fetus. For that, we'll be fixing the abdomen this way, and we'll be pushing towards the umbilicus. And then we will use our other hand to try and start from the fundus all the way down towards the presenting part, right? If you feel something which is regular and curved, and you feel that it's something which is regular, that would be the back of the baby. And it is continuing towards the head, that would be the back of the baby. If, on the other hand, you feel something which is empty and you find some irregular knobs that you feel, that would be the limbs of the baby. So for our second maneuver, the continuation of the second maneuver, we'll also fix this side, and now we'll try to feel for the knobs or the limbs of the baby. And over here you can feel the irregular knobs that you're feeling, and it has no, it's not curved, and you don't feel any irregularity, and it's not continuing with the convexity of the head. So that's our second Leopold maneuver. For our third Leopold maneuver, we're trying to see what is the presenting part. So we've located the part of the fundus. Now we need to locate the part of the symphysis pubis, or the presenting part. So now we'll try and use both of our hands we'll be using our thumb and our middle finger, which will be along the inguinal ligament, to try and have a feel of the presenting part. Now, as we did with the first Leopold maneuver, we'll be doing the same thing here. If you feel something which is small, which is hard, which is palatable, that would be the head of the baby. If you feel something which is large, which is soft, and which is non-palatable, that would be the buttocks of the baby. If you don't feel anything, that means the baby's lie is transverse and you won't be feeling the presenting part. For our last maneuver, we'll be doing the fourth Leopold maneuver, which is to test for engagement. Now, for this particular examination, the position is different. For now, we'll be facing the feet of the mother. Right? Now, you're going to be using both your hands to try and feel the presenting part and try to see how engaged it is. If you can feel all of the presenting part, then that means that the baby is not engaged. If you can feel some of the presenting part, this means that there's partial engagement. And if you don't feel anything, that means that the baby is fully engaged. For our last process, we'll be doing an auscultation for the fetal heart sounds, and we need to be listening for at least 15 seconds. For that, we need to focus on the anterior shoulder of the baby, and that would depend upon the lie or the presentation of the baby. So if, for example, the head is the presenting part, so the shoulder could be on this side or that side, which is below the umbilicus. If the baby is in a transverse lie, that means the shoulder could be here or here, depending upon the position. So we'll be auscultating on either side of the umbilicus. If, for example, the presenting part is the buttocks, so the shoulders naturally would be above the umbilicus, so you will auscultate on either side of the umbilicus. The technique for the auscultation would be, you'll be using this part pointing downwards, and you'll be hearing from this end for at least 15 seconds. So for now, since the shoulder is over here, we'll be trying to hear for 15 seconds. By the third trimester, the heart rate of the fetal heart rate is ranging from around 100 to 160 beats per minute.